I'm John Lentz, City and State Senior Editor, and joining me today is Ignani, the President and CEO of EmblemHealth, a major insurer in New York. Thanks for joining us today.
Thank you, John.
And we're here to talk about a panel that we're going to be doing, a preview of our conference on healthcare. And you're on the feature panel entitled Transitioning to Value-Based Healthcare. I know you've talked a lot about this, how to move from volume-based payment to value-based payment, more collaboration, more coordinated care. So just briefly, could you say where are we at in this big transition, this process we're under?
I think this is a really good question. This is a journey, and I think you can say that for payers and providers. I'm really pleased that Emblem has been the market leader in this transition. And how we approach providers and our clinical partners is in the following way. Once you make a commitment as an organization to move from a fee-for-service based body part by body part reimbursement to something that's more holistic, where you're sharing incentives with providers, they become your partners. So suddenly you move from the opposite side of the table to the same side of the table. You can work together on goals and goal setting with respect to quality. What do we want to do for the patient? What do we want to accomplish over what period of time? And then cost and performance goals. So how do we get cost reduced, which every patient wants, every beneficiary wants, and ultimately the entire system depends on our ability to do that together. So what we find from our perspective at Emblem, having this orientation toward working with our providers in partnership has stood us in good stead as we've worked together with them to change the reimbursement system. I think that not only is that good from a societal perspective, but it's very, very good for patients.
Right, and you've described this as an exciting process, and obviously it sounds great, but it's not going to happen overnight.
No.
And there are obviously some hurdles, some challenges. Right now, what do you see as the biggest obstacle or the biggest thing that needs to be worked out to get where we want to be?
I'll answer that question and also tell you what I think we can do about it. So I think the largest obstacle is that there's a continuum of ability to accept risk on the part of a provider, whether we're talking about a physician practice, or a hospital. So do they have the ability to maintain and manage risk, to be in that different kind of financial arrangement where they are now working with us to achieve specific objectives, and they get the benefit of that, but if they don't meet the objectives, they also have a downside risk. So how do you help a provider that may be on the front end of that continuum actually make that adjustment? What can we do? So the remedy for that is with data. We can provide more data. We can help our clinical partners know that a particular individual is at risk for not having had her feet checked if she's diabetic. I may be at risk of not having a mammogram because I've just put it off year after year. So things of that sort. So we can play a very important partnership role, again, using that word, with our clinical partners to make sure that we're providing support, we're providing care coordination, we're providing data to them so that we help them on this journey as we all make that transition together.
Now, a lot of this was driven by Obamacare, and you were on the front lines, actually, in D.C. You were the president of America's Health Insurance Plans, a powerful lobbying group. And in Politico even called you the woman who could have killed Obamacare. But I'm wondering, having been such an integral part of that process, are you surprised how it's played out? Is there anything that happened differently than you expected?
Well, we always thought that from the beginning of the various proposals, that job one was to make sure we got people into the system who were the healthiest and the lower risk, because we have to balance the risk pool. And that is, I think, a very important learning over the last several years. We're seeing that the people who are coming into the system generally have been uninsured for a period of time. Their costs are higher than anticipated, and that's something that the system has to figure out how to absorb. Now, it has to figure that out at a time when the crucial part of running a pool, an insurance pool, is to make sure that it's balanced. So I think this is one of the issues as states look at rates, look at the proposals that the insurers have put forth. taking into consideration what is the morbidity of the risk pool. Was it high? Was it sicker? Were the individuals sicker than expected? How do we adjust for that? How do we deal with that so we can actually balance the risk pools? And that's something there'll be a lot of discussion about.
And that brings to mind a big issue here in New York. Recently, Health Republic went under, and there are some questions about its rates. Maybe they were too low, maybe it took on too many people too fast, didn't have that experience. And in the wake of that, we just wrote about some proposals the lawmakers have. One would be a guarantee fund to bail out any future collapsed insurer. Another idea is to look at the prior approval process. Maybe that should be more transparent or done away with entirely. I'm just wondering if you had any lessons that you learned from this issue in New York.
This is also a very thoughtful question, and I'm really glad you posed it. I think there are two consequences of some of the proposals around guarantee funds, and they're all bad for consumers. Number one, a guarantee fund doesn't help bail out, so to speak, as you put it, an individual insurer. That adds to the cost of the product at a time when that's the last thing we should be doing. Number one, it's a tax on the product. It's a tax on individuals who are buying. Number two, if you are an individual who's relatively healthy, you are very cost sensitive. So what we need to do is take down costs as opposed to increasing costs. Again, going to that risk pool question that we were talking about, we have to have a balanced risk pool. We have to bring in the young and the healthy so they can offset the costs for the sicker and the older individuals. So that's one of the issues around the guarantee fund that I think those two matters have to be looked at very, very carefully. So from the standpoint, from the prism of a state legislator, is this in the interest of consumers? If you're a consumer who's purchasing the product, to drive up the cost of the product is not in your interest. If you are trying as a regulator or as a legislator to ensure that you have a balanced risk pool, which we know is job one to make an insurance system work, then again, imposing another tax to increase the cost of the product for people who otherwise might not buy, then I think that moves in the wrong direction.
Karen Ignani, thank you.
Thank you.